Some of them that need more answering, okay? So let's go in order, okay? You say on your first question, well, why don't you present your questions and I'll do the answers, okay?
So pretty much the first one was, why don't you guys use, because we've been in the De La Russo office and he was...
Who?
De La Russo.
The guy with 100 lawsuits?
Yes. Not the father, the son was in yours.
The son who got the practice because the father had to stop practicing medicine because he had 100 lawsuits?
Probably, I don't know. But basically, they're using Allegretta IQ, and they're saying that with Allegretta they can do 11.5 ablation area. That eliminates a lot of risks.
Okay, look. You got to be clear that you got to look at the source of information as well as the information. Okay? De La Russo was the senior guy. He was trained in retina, and he went into laser just because he wanted money. And then he did blanket advertising, so he's the most famous laser vision correction surgeon in New York, and he just advertises. And his advertisement says he's like a pioneer. He's not a pioneer of anything. If you talk to any eye surgeon in New York City and you say De La Russo is a pioneer, they're going to laugh in your face. He's got a very, very, very bad reputation in the community. I actually wrote to the Academy saying they should remove him. I wrote to the Academy saying he should be sanctioned because he has 100 lawsuits. He has so many lawsuits, he lost his ability to have malpractice coverage. You know, they're not going to continue to cover you because they're going to lose money, right? Then they put him in a high-risk pool for like bad drivers, you know, if you have too many accidents, they'll put you in a high-risk pool, right? Then he got out of that, they couldn't cover him either. I mean, seriously, when you have 100 lawsuits, you understand no premium is going to make up for that, right? So then he's flying naked, they call it, no insurance at all. Then he transfers his assets to his wife and his kids, so if you sue him, he's got no assets. This is the source of the information that you're receiving, okay? I just want to clear you up on that one. Okay, so the reason that he's using an Allegretto is not because the Allegretto is a better laser. If the Allegretto was a better laser, would it have 5% market share in the United States? Yes or no?
No.
Clearly no. If this was a worse laser, would it have 80% market share? Clearly not. I mean, you are clear, the United States is a free market economy. It's not like one of these pseudo-socialist countries where maybe the government's telling you which laser to buy, or, you know, it's not like that. Every doctor makes his own choice. And doctors are generally smart, okay? So if this is dominant, there has to be a reason. Now he's going to come up with other reasons, and Allegretto has done a really good job of confusing the whole world about their laser, which is what they want to do, okay? Their laser, the reason they lose the Allegretto laser, it's cheaper to use. It's got no click fee, okay? Every time I click this laser on a non-custom patient, it costs me like $250 an eye in royalty fees. Every time I click custom, it's like $500 an eye. I'm paying these guys like several hundred thousands of dollars a year just in royalty fees. So unless I'm a total idiot, I should buy one of these other lasers that's supposedly better. And in 1 year, I would pay for the laser, and in 2 years, I'd be putting another $300,000 in my pocket. Okay, so I have to have some reason for using this laser. The Allegretto laser is not a true custom laser. It is not. You know this a little bit from your responses, okay? They're going to call it wave from optimize.